Hi, welcome to this morning's Women's Misinformation session and how to overcome or analyze the misinformation. Today is 19th February 2022. Today's session comes to you by The Mentoring, a charity based in Cardiff and Wales that supports vulnerable people of all ages and backgrounds through mentoring in the areas of education, employment, health, and community cohesion. We also do bespoke one-to-one mentoring sessions where vulnerable individuals may require, and we train people on mentoring skills. As part of the project Promoting a Healthy Community, a year-long project that will provide online chat room sessions with a minimum of 3 healthcare experts to deliver information, facilitate a discussion and answer questions on a topic chosen by the community itself. So we have held sessions like this within the community before, focusing on COVID-19 last year and the misinformation surrounding protection protocol and vaccination and vaccines. So this project that we are delivering today is called Promoting a Healthy Community, and that aims to address the misinformation that the community has received on a number of health issues. Many members of the community receive their information on healthcare through word of mouth or from many conflicting resources or sources like WhatsApp and Google. So we aim to tackle the abundance of misinformation in the community through using medical specialists like today we've got Dr. Sasha, to provide educational and informational sessions. So these sessions will empower the community members to make informed decisions on their health. The challenges that we have seen is the misinformation in our community is so abundant and often the most vulnerable or most isolated and difficult to reach. So the key outcome of today's session or the end of this session, we aim to help you overcome misinformation around women's health issues in and around the topics covered today. This project, Promoting a Healthy Community, is being worked in collaboration with Bevan Commission. I don't know if Bevan Commission is here, but they said they may be coming along. So let's see if they come and join us. And it's time for me to hand it over to Sasha Ang. But before that, I would like to say that we may come back with awareness sessions on cancer awareness sessions and how important cancer screening is for all of us. So over to Dr. Sasha Ang, who is a junior doctor who was born in Singapore and studied medicine at the University of Birmingham. She now works in the William Harvey Hospital in Kent, having just completed a rotation in their women's health department. Over to you, Dr. Sasha Yang.
Thank you very much. I'm going to start now by sharing my slides. Just give me a moment. So can everyone see my slides? Good, okay. Good, so hi, I'm Sasha. As Sujatha said, I'm currently a junior doctor at William Harvey Hospital. 1 second, give me 1 second.
Presenter view.
Apologies for that. I think the wrong presentation was being presented, but this is the right one now. Good. So my name is Sasha. I'm one of the doctors currently at William Harvey Hospital. So today, let me just move on to the next slide. So yes, today's session is on information and misinformation around women's health. So initially, I'll discuss several topics structured around questions that I've been asked by many patients before, and I think that it's really worthwhile to explore. So the first few topics are centered around COVID, and particularly some of the misinformation that exists relating to women's health. And then we'll transition on to discuss questions relating to cancers that women experience, particularly what red flag symptoms to look out for. And additionally here, the last question, we'll be exploring questions relating to your family risk of cancers. So firstly, our first question is whether or not the COVID vaccine is safe for pregnant women. So one of the reasons why people ask this question is that initially, when the vaccines first came out, the first trials that tested the safety and efficacy of the vaccine were not done on pregnant women. However, this is not a bad thing at all, simply because those were the first trials looking at the general population. And when you do research like this, you have to start broad and then narrow down your so since then, we've had more time to carry out more studies on pregnant women, and we found that the vaccine is just as safe and effective for them too. So I've included here a summary from the CDC, but the NHS guidelines reflects exactly the same thing. So firstly, it's important to know that if you are currently or recently have been pregnant, you're at higher risk of COVID. However, we know that getting the vaccine reduces this risk. In fact, UK data has shown that almost every pregnant woman needing hospital treatment or ICU treatment because of COVID was unvaccinated. And if you ask any doctor who works on the COVID wards, they'll say exactly the same thing, that these patients coming in who are very unwell and need treatment for COVID are almost completely unvaccinated. Therefore, getting the vaccine and boosters are definitely recommended. So some other factors to note are that in terms of vaccine safety, all of the data on women so far show no increased risk of miscarriage if you have had the COVID vaccine. So if we see here, before the pandemic, we knew that between 10 to 15% of pregnancies unfortunately end in miscarriage. The data for unvaccinated women is exactly in the middle of this expected range. Additionally, despite over 100 million confirmed COVID infections worldwide, there has been no reported increase in the incidence of congenital anomalies as well. Thirdly, it seems likely that neonatal morbidity for babies born to mothers with COVID-19 infection is linked to preterm birth rather than the COVID-19 infection itself. While stillbirth remains a rare outcome in general, maternal COVID-19 infections is associated with an increased risk of stillbirth. As mentioned, pregnant women are more likely to get severely ill with COVID, and UK data shows that COVID disease was associated with a more than 25 times more deaths than women without COVID. So all the information that I've included here is sourced from the links down at the bottom right-hand corner of this slide. And if anyone wants to read into this, feel free to contact TMR for the slides and for the links to look further at the data. So in summary, COVID is bad news for pregnant women, and the vaccine reduces these risks whilst being safe for pregnant women. So another common question is whether or not it is okay to get vaccinated whilst breastfeeding, which is a good question to ask because some medications must be stopped whilst breastfeeding because they can accumulate in the breast milk that a child drinks. Indeed, some specific types of vaccines, like the yellow fever vaccine, can't be taken whilst breastfeeding because it is what we call a live virus vaccine. The COVID vaccine, however, is not a live virus vaccine. To put it simply, they just have small bits of the original COVID virus in it. So unlike the yellow fever vaccine, the COVID-19 vaccines do not carry a risk of getting an active infection. Therefore, current guidelines are that yes, it is safe to get vaccinated whilst breastfeeding. In fact, evidence thus far shows that the vaccine itself does not pass into the breast milk that a child drinks. However, the antibodies that the mother's immune system produces in response to vaccination to fight COVID does pass into breast milk. This is great news, as it could likely mean that getting vaccinated, by getting vaccinated, you're not only protecting yourself, but also your child through breastfeeding. Current NHS recommendations based on all this are that therefore, yes, you can and you should get vaccinated whilst you are breastfeeding. And so I urge everyone who's breastfeeding to get a jab if they're due one. So here we have a slide which has actually been included in one of the previous TMR talks as well, that addresses quite a common question that we get from patients. And this is whether or not the COVID vaccine reduces fertility. Unfortunately, I myself have met quite a few patients who've quoted this as a concern, and this is the reason why they didn't get vaccinated, and unfortunately has come to hospital feeling very unwell with COVID. So the myth of this comes based on assumption that the vaccine could cause the body to attack a specific protein in the placenta that is similar to the spike protein of the coronavirus. So the idea was that your immune system will get mixed up and attack the placental protein instead. However, this was purely theoretical, and there's no real-world data supporting it from the trials in the vaccine. And since the vaccine has been administered to millions of people worldwide over the last few years, we still have no evidence supporting any changes into fertility from the vaccine. Studies since have shown that vaccinated and unvaccinated women are equally as likely to have success with IVF treatment. And as I mentioned earlier, the rate of miscarriage in populations who have been vaccinated and unvaccinated is completely the same at 12.5%. And this is the same from the population even before COVID. In fact, the flip side might actually be true. Some studies have shown that COVID virus has been found in the sperm of men with COVID-19 infection, and that the COVID virus may impact on male hormones necessary for normal sperm production. And there are numerous reports of men with testicular or scrotal pain after getting the COVID-19 disease. So next, another useful topic to touch on would be some of the major gynecological cancers, such as endometrial, breast, and ovarian. A simple diagram here is included on this slide to ensure everyone knows the anatomy that I'm referring to. So the uterus here is another name for the womb. The cervix here is another name for the neck of the womb. And the endometrium here is called the lining or the wallpaper of the womb. So what we'll run on here are specific symptoms to look out for that may be associated with these cancers. So for uterine cancer, the most important symptom to keep in mind is bleeding or spotting from the vagina after menopause. If this ever occurs, please make sure to see your GP, who can organize further investigations as necessary. Various other symptoms are also listed here, but it's important to keep in mind that there are a lot of different possibilities that may cause these other symptoms. For example, discomfort in the abdomen is extremely vague, and everyone experiences something like this throughout their lives, but this could be something as simple as indigestion. Difficulty or pain when urinating is another example that is much more likely to represent a urinary tract infection rather than uterine cancer. However, new onset bleeding after menopause is much more of a red flag and is definitely one to keep in mind. Moving on to breast cancer, what to look out for is for the most part simple. Any new lump notable in the breast is enough of a reason to book an appointment with your GP to get this checked out. Here is a very useful infographic summarizing a lot of the associated symptoms to keep in mind as well. So nipple discharge at any time, unless you've just had a child and you're lactating, would be something worth looking into, as with any skin changes like dimpling, redness, texture changes, or swelling. If any of these are present, particularly if alongside a lump, it's very important to have a doctor assess you. Ovarian cancer, on the other hand, is probably one of the least talked about cancers in the public eye, yet it's one of the most deadliest cancers in women. In fact, from diagnosis of breast cancer, almost 90% of women are likely to survive at least 5 years, However, with ovarian cancer, only 45% of women survive 5 years. What many people don't realize is that the various warning signs to look out for, which of course is the point of having sessions like these today. Some warning signs are listed here. And again, a lot of these are very vague and don't necessarily mean anything, but it's the context of the whole picture that matters. However, the most important symptom here to look out for are likely these 3 symptoms. If you experience a combination of persistent bloating, pelvic pain, and abnormal menstrual periods, then it's definitely worth contacting your GP. You'll notice additionally that painful intercourse is also on this list again, and was also on the list 2 slides ago for endometrial or uterine cancer. If intercourse is suddenly painful when it wasn't before in the past, then that's definitely always worth getting checked out. Painful intercourse in particularly could definitely be something other than cancer, like fibroids, an infection, or a cyst. And there's a long list of options that don't include cancer, but this is still definitely getting worth checked out. Unfortunately, because it's, of course, a topic that a lot of women don't feel comfortable discussing, it's a symptom that's often ignored and unchecked, and it definitely shouldn't be. So the final question we'll be considering in today's session is the following. Do I need a checkup if multiple women in my family have had cancer? What this question here is relating to is there an inherited condition in my family that means that I'm more likely to get a certain cancer? The most generic answer to this is, if you have 2 or more relatives on the same side of your family who are diagnosed with the same cancer, particularly if they were young when they were diagnosed, so less than 50 years old, then it's definitely worth discussing this with your GP. Note that this advice isn't just for women's cancer. So for example, if there's multiple instances of colon cancer in your family, on one side of your family in particular, you should definitely discuss that with your GP. So let's go into a quick example of this with this diagram here. So here we can see Tom's family. And you can see that in Tom's family, there are 2 instances of prostate cancer, one in his dad, as well as one in his mother's dad. However, these are on different sides of the family. His mom's dad and his dad are not genetically related. And so these 2 instances of prostate cancer are not because of a family condition. You often see this in prostate cancer in families anyway, because of how prevalent it is in elderly males in general. One thing to note for ovarian cancers, however, is that this can be related to breast cancers too. So if you have 1 instance of breast and 1 instance of ovarian cancer on the same side of your family, as Tom actually does with his sister and his paternal grandmother, then depending on how early those cancers developed, especially as it seems like his sister was very young when she was diagnosed, it could definitely be worthwhile for Tom to organize a visit with his GP if he ever has daughters to discuss his risks or his daughter's risks. So for breast cancer specifically, if any of this criteria here applies to your family, it's definitely worth exploring this with your GP. Men can actually also develop breast cancer too, although it's extremely rare. And if it does occur, it may mean that they have a familial risk too, and that their close blood female relatives should consider discussing their own risk with their GP. And when we say close blood relatives, we mean first-degree relatives, so full siblings, parents, or children. So finally, none of those symptoms or those slides that we discussed doesn't apply to cervical cancer, because we have a national cervical screening program for anyone who's 25 years or older. Cervical cancer is the most common cancer for younger women under 35 years old, and is easily discovered through the national screening program that we have established by the NHS, and is almost always curable if found early enough, with 3/4 of cancers preventable through this program. If left undiscovered and untreated, this can be deadly. And so if you haven't already, I urge you to book your screening appointment with your GP now, especially if you're 25 years or older. So in summary, the COVID vaccine is safe for pregnant women and will prevent any additional risks of COVID during pregnancy. The COVID vaccine is safe whilst breastfeeding. The vaccine itself does not pass into the breast milk, but protective maternal antibodies do, granting additional protection to the child from COVID. There is no evidence from that the COVID vaccine reduces fertility. If you notice a combination of the symptoms that we discussed today, please organize a GP appointment to decide whether or not further investigations are warranted. If multiple members of your blood-related family have developed breast, endometrial, or ovarian cancer, particularly if they were young when they were diagnosed, then you should discuss this with your GP as to whether or not you would need additional screening. Thank you very much for listening to my talk. I'll now invite any questions that anyone might have, and also invite Dr. Girish to help answer any questions as he helped me prepare these slides as well.
Do you want to stop sharing so we can see you, Sasha?
Yeah, sure.
Please.
Sorry, I've got a question. I've missed a bit of fertility. I know you've just mentioned that the fertility, it's not been really been, searched to say that the COVID wouldn't affect the fertility. Is that correct?
I'm sorry, I can't hear you quite well. Is your question that whether or not it's correct that the COVID vaccine doesn't affect your fertility?
Yeah, for about 40 years old, my daughter.
Yeah, definitely. So yes, thanks. So yeah, like I said, the COVID vaccine doesn't affect your fertility, even if you are less than 40 years old. And this is demonstrated in all of the studies that have been carried out, as well as your fertility. The rates of miscarriage are exactly the same. So 10 to 12.5% in patients who have had the COVID vaccine. As this data is exactly the same even before the COVID pandemic started, which means that we've not shown an increase in the risks of miscarriage.
I see. So it's a safe way to take the COVID vaccine.
Exactly, yeah. It's not only safe to take your COVID with your fertility. If you do get pregnant, then it reduces your risks of associated when you get COVID during pregnancy.
I see. So it's best to take it, how old you are, even though under 14, if you're not, planning to have children, you should have it, yeah?
Yes, exactly. Even if you are planning to have children and you're a young woman, I would definitely urge you to take the vaccine.
Okay, thank you very much. Thanks.
That's okay, thank you.
Thank you very much, Dr. Sasha.
Sorry, Dr. Sasha, sorry, before you go. I know about fertility. Thank you for making people aware of this. But I want to find out about children. Now they want to. I'm sorry, I have to use the word experiment. On starting little children. How many people have they worked upon to say that it's safe for the children? And how?
Yeah, that's a very good question, actually. Unfortunately, this talk doesn't focus on children, more focuses on women's health, so I don't have the data with me on hand. But that's definitely another session that we can do, is focusing on vaccine in children and whether or not that's safe. And we can arrange another session for that and let you know.
Yes, if you could, that's very important, because I feel all this vaccination is. I know it doesn't give a person so many signs and symptoms after they've had the COVID, when they've had been vaccinated, but they're still getting it. Everybody's still catching it. It's how much immunity are we having? We've had 3 injections, and now we're going to have another one. I mean, surely there has to be. There has to be a logical reason, not just you've got you're still not safe and you go out, you're still going to get it. And
could I ask this, if that's okay?
So that's another question which, if you could work on and let us know, and definitely about children, because
hi, this is Dr. Girish as well. So if I could just add to that question as well, that's a really interesting question that you've mentioned, because a lot of patients often say this, that they've had multiple vaccines, but the issue is that they're still getting infections. One of the most important things to consider with the vaccination is that even if you get COVID again after being vaccinated, one of the key parts of the vaccine is that it reduces the severity of subsequent infection. So you might get COVID again, and that might make you think, oh, did the vaccine work at all? But the data, the best part of the data is that you're less likely to be hospitalized if you get it again, and you're less likely to get severe symptoms if you get COVID again. So that's actually what we're trying to achieve with the COVID vaccine. It's not necessarily that you will never ever get COVID again, but it's that if you do, you won't be as severely affected. Does that make sense?
Yes, but I've had friends, who've been vaccinated, and they caught it, although they had COVID once, and then they had the vaccination, and still they had such severe COVID that they had to they had to go to the hospital to A&E, with this breathlessness and everything, and it was quite shocking because, and this person, because he was susceptible, he was a known asthmatic and all that, but so the people who are vulnerable are still going to be affected more than people who are not. So where does this vaccine stand, if you see what I mean? Like, I don't have chest diseases, so I won't be so vulnerable as somebody who's got chest disease, underlying chest disease, if you see what I mean.
Yeah, absolutely. The reason that patients are keeping on getting these infections is because the virus keeps mutating. I'm sure we've all heard of the Omicron strain. Before that, it was the Delta strain, and it's changing again and again. And that's why we keep getting COVID again and again, and why people who've had COVID before and have even been vaccinated, because the virus is mutating, they're getting it again. It's difficult for me to comment on individual patients because, of course, I don't know the details of this patient. But it sounds like if this patient is at high risk, it's obviously impossible to say for sure, but it's quite likely that getting the vaccine did protect that individual even a little bit from the severity of the subsequent infection. And obviously, you're saying that they went back to A&E and they had quite a severe infection, and of course that's really awful, and I'm really sorry to hear that. But it's quite possible, based on at least what the research is saying, that if they hadn't have had that vaccine, they might have had an even worse infection when they got that second infection, if that makes sense.
Yes.
Thank you, Milind. That was good for you to chip in and then clear our questions from the audience. Thank you, Yasmin.
Sorry, I'm interrupting again. I want to ask, what was the name, Dr.
Milind.
Yeah. Can you do you know anything about why about children being children being vaccinated? Or have you got any answers for that by any chance? Since you've been with the patient.
I think what Sasha said is probably the best idea, that to give us the time to go away and look at the research is probably the best idea, and then we can give you a full session going into all of the research. But I would say that it's quite a similar situation to what Sasha was saying earlier, Dr. Sasha Ang, where she was saying that in the initial research looking into COVID didn't look into pregnant women, which is, again, we have to start broad and then work into these smaller populations. And I think that's the same situation with children. The initial studies obviously started with the general population, but didn't focus on children. But of course, now it's been a significant amount of time since we've had the initial vaccines. More research is popping up. So we'd be more than happy to look into that and then do a subsequent sweat session and give you a full answer on that. I think that's the best thing to do.
Thank you very much. Thank you.
Thank you, Yasmin. That was very interactive. You know what? This leads to us developing more sessions like this for us, for you to come back, also Dr. Sasha or Milind or anybody else. So we're going to come back soon. And if there is any questions, please let us know. And this is being organized by the Mentoring charity based in Cardiff. As I said, we will be coming back with cancer awareness and importance of cancer screening soon. And thank you very much, Dr. Sasha, and for coming today and taking time on a weekend as well as preparing for this session. We really appreciate.